Over the ensuing years, consistent findings emerged. Creatine is particularly effective for activities reliant on the phosphagen energy system, lasting 30 seconds, such as sprinting, jumping, or heavy resistance sets. A consensus statement by the International Society of Sports Nutrition, ISSN, in 2007 flatly stated that creatine monohydrate is the most effective ergogenic nutritional supplement currently available to athletes for increasing high-intensity exercise capacity and muscle mass. This was reaffirmed in the ISSN's updated 2017 position stand, which also noted creatine's benefits for exercise recovery, injury prevention, and rehabilitation context. Creatine monohydrate supplementation, benefits and potential drawbacks. Introduction and historical perspective. Creatine monohydrate is one of the most extensively researched dietary supplements in sports nutrition. It gained popularity in the early 1990s after studies showed that oral creatine could significantly increase muscle creatine stores. Harris et al., 1992, published a seminal study demonstrating that a high-dose creatine regimen increased muscle total creatine content by about 20%. Soon after, athletes and bodybuilders widely adopted creatine for its performance benefits, and researchers launched hundreds of trials examining its efficacy and safety. Biosynthesis and utilization of creatine. Creatine can be obtained from diet or synthesized from amino acids via AGAT and GAMT enzymes. It is transported into target tissues, e.g. muscle, by creatine transporters, CRT, where creatine kinase, CK, uses it to rapidly regenerate ATP from ADP via phosphocreatine, PCR. This system provides quick energy in cells with high demands, like skeletal muscle and brain. Early anecdotal reports and media coverage raised concerns about possible side effects, ranging from dehydration to kidney strain, but accumulating scientific evidence over decades has clarified many of these issues. Today, creatine monohydrate is not only a staple supplement in strength and power sports, but also a subject of medical research for potential therapeutic benefits in various organ systems. This report provides a comprehensive look at creatine's benefits for different systems, including the brain, skeletal muscles, heart, endothelium, nervous system, and digestive system, as well as the possible drawbacks and side effects on organs like the kidneys and liver. We will highlight key studies, noting study design, e.g., randomized controlled trials, RCTs, meta-analyses, case studies, and take a historical approach comparing early findings to recent evidence, drawing from peer-reviewed journals, clinical guidelines, and reputable fitness resources. Brain benefits, cognition and neuroprotection. Cognitive performance. Although creatine is best known for muscular effects, research since the 2000s indicates it can also impact the brain. Creatine plays a vital role in brain energy homeostasis, and raising brain creatine levels through supplementation may enhance certain cognitive functions. For example, early trials in the 2000s suggested improved memory and intelligence with creatine. A 2003 randomized trial on young adult vegetarians found that 5 grams per day of creatine for 6 weeks significantly boosted working memory and intelligence test scores. Vegetarians, who have lower baseline creatine stores due to low dietary intake, showed greater cognitive improvements than omnivores in this study, hinting that brain creatine availability was a limiting factor for memory. In the following years, results were mixed for certain cognitive tasks, but interest grew in using creatine to aid cognition under stressful conditions, such as sleep deprivation or mental fatigue. Recent evidence, larger and more rigorous analyses have been conducted recently. A 2024 systematic review and meta-analysis of RCTs concluded that creatine supplementation can confer beneficial effects on specific cognitive domains, particularly memory performance, attention span, and processing speed. Notably, the meta-analysis found significant improvements in memory, especially in tasks like recall, and modest gains in attention and mental processing in adults taking creatine, although overall effects on global cognition were small. These benefits may be more pronounced in populations under higher energetic stress, e.g., older adults with cognitive decline or individuals with sleep loss, according to subgroup analyses. In line with this, an earlier 2018 review by Rawson notes that several studies have shown improved cognitive processing with creatine, and even suggests it might help reduce concussion severity or duration, based on preliminary data. That said, not all organizations are fully convinced. A 2024 FSA panel review, evaluating a health claim for creatine and cognition, weighed the evidence and concluded the data were still too inconsistent to establish a definite cause and effect relationship for general cognitive improvement. The FSA experts noted that while a few short-term studies at high doses, 20 grams per day for 5 to 7 days, showed acute improvements in working memory, these effects were not seen at typical lower doses or with longer continuous use. They also pointed out that clinical trials in cognitively impaired or diseased populations hadn't convincingly demonstrated benefits. In summary, the current consensus is that creatine can improve certain aspects of cognitive function, especially memory, in healthy adults, as supported by recent meta-analytic evidence, but more large trials are needed for confirmation. The cognitive benefits seem most evident when brain energy demand is high or baseline creatine levels are low, e.g. in vegetarians or sleep-deprived individuals. Neuroprotective and neurological effects. Beyond day-to-day cognition, creatine has been studied as a neuroprotective agent in neurological diseases. Early animal studies and mechanistic research showed creatine can support neuronal energy metabolism and reduce oxidative stress in brain tissue. This led to trials in conditions like Parkinson's disease, PD, a neurodegenerative disorder, in the 2000s. Small-scale studies and a Phase 2 trial suggested creatine might slow PD progression by improving mitochondrial function. However, a large NIH-sponsored 5-year RCT in Parkinson's patients, the NAT-PDLS1 trial, reported in 2015 that creatine, up to 5 years of use, did not significantly improve clinical outcomes in PD compared to placebo. Similarly, trials in ALS, amyotrophic lateral sclerosis, and Huntington's disease have not shown clear benefits, despite positive signs in animal models. On the other hand, creatine has shown promise in traumatic brain injury, TBI, recovery. In a notable 2006 open-label trial in children with severe TBI, high-dose creatine, 0.4 grams per kilogram per day for 6 months, led to better outcomes, shorter duration of post-traumatic amnesia, reduced frequency of headaches and dizziness, and overall improved recovery metrics, compared to historical controls. Another trial by Sakalaris et al. Reported that creatine-treated TBI patients had significantly fewer complications such as fatigue and cognitive decline. These pediatric studies, though not blinded placebo-controlled, suggest creatine's cell-protective effects may translate to improved neuronal resilience after injury. Additionally, creatine's potential psychiatric effects have been explored, e.g., adjunctive creatine in depression or anxiety management, given its role in cellular energy, though findings are still preliminary. A 2014 review of creatine in age-related and neurological diseases noted it had been investigated as a neuromodulator with some positive findings in conditions like resistant depression and schizophrenia, influencing brain bioenergetics and neurotransmitters, but clear clinical recommendations are lacking. Overall, from a historical perspective, early hopes that creatine could be a major neuroprotective therapy for diseases like PD-ALS have tempered after large trials showed null results. Yet, creatine still holds potential as a supplemental strategy for brain health. It may modestly improve cognitive performance, especially under stress, and help in recovery from brain injuries, warranting further research. Skeletal muscle benefits, strength, performance, and mass. The ergogenic benefits of creatine for skeletal muscle are well established and are the reason creatine became a popular supplement. Dozens of RCTs and multiple meta-analyses have documented that creatine monohydrate improves performance in high-intensity, short-duration exercise and enhances training adaptations. As early as the mid-1990s, studies showed that creatine loading, typically approximately 20 grams per day for 5 to 7 days, could increase muscle phosphocreatine stores and thereby delay fatigue during repetitive maximal contractions. For example, Greenhalgh et al. 1993, reported that short-term creatine supplementation improved muscle torque production during repeated maximal sprints, an early placebo-controlled trial demonstrating performance gains. Over the ensuing years, consistent findings emerged. Creatine is particularly effective for activities reliant on the phosphagen energy system, lasting 30 seconds, such as sprinting, jumping, or heavy resistance sets. A consensus statement by the International Society of Sports Nutrition, ISSN, in 2007 flatly stated that creatine monohydrate is the most effective ergogenic nutritional supplement currently available to athletes for increasing high-intensity exercise capacity and muscle mass. This was reaffirmed in the ISSN's updated 2017 position stand, which also noted creatine's benefits for exercise recovery, injury prevention, and rehabilitation contexts. Strength and power. Meta-analyses have quantified creatine's impact. For instance, a 2017 systematic review and meta-analysis of 22 trials found that adding creatine to a resistance training program significantly increased maximal strength gains, 1 rep max in bench press and squat, and lean muscle mass compared to training alone. The typical magnitude of improvement in strength is on the order of 5 to 15% greater gains than placebo, depending on the training protocol and population. Creatine also reliably increases muscle power output and sprint performance in repeated sprint tests. These effects are attributed to higher intramuscular phosphocreatine availability, which allows quicker ATP regeneration during intense effort, and to downstream training benefits. Heavier lifts and more total work translate into greater hypertrophy and strength over time. Notably, creatine's benefits are not limited to young male athletes. Research in older adults, 50+ years, indicates that creatine plus resistance training leads to greater improvements in strength and muscle fiber size than training alone. A 2021 meta-analysis of RCTs in older adults, total NE in 1,000, confirmed significant gains in upper body and lower body strength from creatine use. Muscle hypertrophy and recovery. Creatine supplementation is also associated with increased lean body mass. Some of the weight gain in the first week is due to water retention. Creatine pulls water into muscle cells, but longer-term studies show true muscle accretion. One review found an average of approximately 1 to 2 kilogram greater increase in fat-free mass after several months of training with creatine versus placebo. Mechanistically, beyond just enabling higher training loads, creatine may have direct cellular effects that enhance muscle growth, e.g., upregulating satellite cell activity and anabolic growth factors, as suggested by cellular studies. Athletes often report improved post-exercise recovery when using creatine. There is some evidence, from clinical trials and ISSN's position stand, that creatine may reduce exercise-induced muscle damage and inflammation, possibly speeding recovery between intense bouts. However, these recovery benefits are still being researched and appear less pronounced than the performance effects. Historical perspective. In the 1990s, creatine's muscle benefits were so evident that it quickly moved from the lab to the field. By the 1996 Atlanta Olympics, an estimated number of medal-winning sprinters and weightlifters were reportedly using creatine. Early skepticism and questions, e.g., was it just water weight? Was it an anabolic steroid in disguise? Have been largely put to rest by scientific data. By the 2000s, creatine was accepted in sports science as a legitimate and safe performance aid. Leading sports nutrition organizations, ISSN, NCAA, etc., acknowledged its efficacy for anaerobic performance and allowed its use. Recent studies continue to expand creatine's applications. For example, research has explored creatine combined with protein or carbohydrate for synergy, and use in female athletes, who also respond, though some evidence suggests slightly smaller average gains than males, possibly due to lower baseline muscle creatine. Additionally, clinical research has examined creatine for muscle health in disease conditions, e.g. muscular dystrophies, cachexia in chronic illness. Some trials in muscular dystrophy showed improved muscle strength and fat-free mass in pediatric patients on creatine. Taken together, after nearly 3 decades of study, creatine's benefit for skeletal muscles is one of the most proven in the supplement world. It consistently enhances high-intensity exercise capacity and training adaptations in a variety of populations. Heart and cardiovascular benefits. Cardiac muscle energy and heart failure. The heart, like skeletal muscle, uses phosphocreatine as a quick energy buffer. In heart disease, especially heart failure, where the heart's pumping ability is weakened, myocardial creatine and phosphocreatine levels are often depressed. This led researchers to hypothesize that creatine supplementation could benefit heart function or exercise capacity in cardiac patients. Animal studies in the 1990s showed that failing hearts had 30–40% lower creatine content than normal, and that creatine depletion correlated with poorer contractile function. Small clinical trials in the late 1990s provided some encouraging results. For example, Gordon et al., 1995, conducted a double-blind RCT in patients with chronic heart failure. finding that creatine supplementation increased skeletal muscle creatine phosphate levels and improved muscle strength and endurance in these patients. The creatine group in this trial could perform more work in strength tests, suggesting reduced muscle fatigue. Similarly, another RCT by Andrews et al., 1998, 20 GA a day for 5 days in heart failure patients, reported significantly improved muscle endurance, increased number of knee extensions to fatigue, with creatine versus placebo. These early studies did not show large changes in cardiac ejection fraction or cardiac output, but the improved peripheral muscle function translated to better exercise tolerance. In fact, one placebo-controlled trial noted that peak oxygen uptake, VO2 peak, a key measure of exercise capacity, was higher in the creatine-supplemented heart failure group, even though the dose used was quite low, only approximately 0.3 grams per day. This hinted that creatine might help energize patients enough to exercise more. However, later research produced mixed outcomes. A longer-term 6-month RCT, 2006, in heart failure, NYHA Class 2 of 4, found no significant improvement in cardiac performance metrics, like ejection fraction or exercise test duration, with creatine compared to placebo. Interestingly, that study did observe that only in the creatine group was there a positive correlation between muscle strength gains and quality of life scores, suggesting some benefit that clinical measures didn't fully capture. Given the inconsistent findings, creatine has not become part of standard heart failure therapy. Contemporary reviews, e.g., a 2021 review in Nutrients, conclude that while oral creatine can raise myocardial energy stores in heart failure, the direct effects on cardiac contractility are modest. The main benefit appears to be in the skeletal muscle of heart patients, improving their strength and endurance, which is valuable because heart failure often causes muscle weakness and exercise intolerance. Thus, creatine might be seen as an adjunct to improve functional capacity in those patients, though more research is needed to confirm long-term outcome benefits and any safety considerations in this population. Vascular and endothelial function. An emerging area of creatine research is its effect on the vascular system, particularly the endothelium, the inner lining of blood vessels. The endothelium is crucial for regulating blood flow, vessel dilation, and cardiovascular health. Creatine's role here is not as intuitively obvious as in muscle, but a few studies suggest potential benefits. Creatine has antioxidant properties and may influence nitric oxide production in endothelial cells. In 2014, a pilot clinical study by Moraes et al. Investigated creatine's impact on microvascular circulation. In this open-label trial, 40 healthy young men took high-dose creatine, 20 grams per day for 1 week, and underwent tests of endothelial-dependent microvascular reactivity using laser speckle imaging and capillary microscopy. The results showed a clear improvement. Skin capillary density increased, and microvascular blood flow responses, post-occlusion hyperemia, were significantly enhanced after creatine supplementation. The authors concluded that oral creatine improves systemic endothelial-dependent microvascular reactivity in healthy individuals. In other words, creatine made the small blood vessels function better, potentially by making the endothelium release more dilators like nitric oxide, or by protecting against oxidative stress. This was a short-term study, so it's uncertain if longer use confers sustained vascular benefits. Additional support comes from mechanistic studies. In vitro experiments have found that phosphocreatine can reduce oxidative damage in endothelial cells, preserving their function. There is also evidence from a small 2011 trial that creatine supplementation blunted the increase in arterial stiffness that normally occurs after a high-fat meal or intense exercise, implying a favorable effect on blood vessel elasticity. Furthermore, a 2021 review in Nutrients noted that only a few human studies have directly examined creatine's vascular effects, but collectively they hint at novel benefits of creatine for vascular health, especially in at-risk populations, e.g. the older adults with endothelial dysfunction. For instance, a 2019 pilot study in older adults found 4 weeks of creatine supplementation produced favorable changes in some vascular health markers, like reduced arterial stiffness, though sample size was small. Overall, while not a traditional use of creatine, these findings suggest it might support cardiovascular health by improving endothelial function and blood flow. It's a new frontier of research. As one paper put it, creatine's application as a vascular therapy is relatively new and requires further investigation, given only a handful of clinical studies so far. Historically, Early 2000s creatine research didn't focus on this area, so this represents a shift as scientists explore creatine's pleiotropic, multi-system effects beyond muscle. Digestive system benefits, gut health and disease. Creatine's influence on the digestive system is an intriguing nascent field of study. Traditionally, creatine wasn't associated with gut benefits. If anything, high doses could cause gastrointestinal upset in some users. More on that in side effects. However, recent research suggests that creatine might play a role in intestinal energy metabolism and barrier function, which has implications for digestive health. The lining of the gut, intestinal epithelium, is a high-energy demand tissue that, much like muscle and brain, uses phosphocreatine to shuttle energy within cells. Scientists have observed that patients with inflammatory bowel disease, IBD, often have reduced expression of the creatine transporter in their intestinal cells, hinting that impaired creatine availability could contribute to an energy deficit in gut tissue. Animal studies in colitis. A breakthrough came from preclinical studies in 2017 to 2020. In a mouse model of ulcerative colitis, an IBD, supplemental creatine helped maintain intestinal wall integrity and reduced colon inflammation. Specifically, a 2020 experimental study found that creatine supplementation increased creatine content in intestinal epithelial cells and improved their energy status, which strengthened the gut barrier and protected against colitis-induced damage. Mice given creatine had less epithelial cell death and less leaky gut lining under colitic conditions. These findings directly link creatine's cellular energy role to intestinal homeostasis. When creatine is lacking, the gut lining is more susceptible to injury and inflammation, whereas ample creatine bolsters the barrier. In fact, one study noted that loss of creatine availability led to worse colitis in mice, while creatine supplementation ameliorated the colitis severity, fewer ulcers and lower inflammatory markers. Implications for humans, IBD patients. Following the animal data, researchers have begun to explore creatine in human gut disorders. It is still early. No large clinical trials in Crohn's or ulcerative colitis have been completed, but observational evidence is promising. Investigators have reported that people with ulcerative colitis tend to have lower creatine levels in their colon tissue. The idea is that chronic inflammation and rapid cell turnover in IBD might deplete cellular creatine, worsening energy stress in the gut. By supplementing creatine, one might restore the energy balance. A 2021 article in a gastroenterology journal even posed creatine as a potential complementary therapy for IBD, citing its anti-inflammatory and barrier-supporting effects observed in lab studies. Experts emphasize this is not a cure or primary treatment, but it could be an adjunct to help fortify the gut lining. A 2023 review, Healthline Medically Reviewed, summarized that emerging research suggests creatine might help improve symptoms of ulcerative colitis. It highlighted that creatine could address low creatine levels seen in IBD, enhance the intestinal barrier function, and exert anti-inflammatory effects, though human trials are needed. Beyond IBD, a well-functioning intestinal barrier is crucial in many conditions, from infectious diarrhea to irritable bowel syndrome, so this line of research may broaden. It's worth noting this represents a historical shift. Early creatine research focused on muscles and athletic performance. Only in the last decade have scientists seriously considered creatine's role in organs like the colon. As of 2025, we can say there is no established clinical guideline to use creatine for digestive ailments yet. But the concept of creatine supplementation benefiting the digestive system by maintaining epithelial integrity and possibly reducing gut inflammation is supported by strong mechanistic evidence in animals and is an active area of investigation.